Good evening. Myself, Dr. Sri Ramulu, consultant nephrologist, working in Velamal Medical College Hospital with 20 years of experience in the nephrology field. In today's topic is 10 facts I wish I had known before my renal transplantations. In today's discussion, I am going to highlight 10 facts about the renal transplantation that everyone should know, especially patient having chronic kidney disease and their relatives. Before going to the discussion, I want to point out 3 important medical terms in common use related to transplantation. The first term is a donor, refers to any healthy person who is going to donate the kidney. The second term is the recipient. It refers to a patient who is going to receive the kidney from the healthy donor. And the third medical term is the graft. It refers to the kidney taken from the donor and going to be kept inside the patients. In today's discussion, I am going to highlight certain facts related to donor and certain facts related to the recipient. First, let us see the facts related to the donor. The living kidney donation is the best option for a people who need a new kidney. Many living donors don't want their loved ones to wait months or even years for a kidney on the national transplant waiting list. The transplant surgeons have successfully performed living kidney donation surgeries since the year of 1950s. In fact, donating a kidney is the most common living organ donation. Living kidney donation is also a safe procedure. If you are healthy, donating a kidney won't make you more likely to get sick or have a major health problem. Like any surgery, the procedure does have some risk. But overall, living kidney donation is safe. In most cases, donating a kidney will not raise your risk of kidney disease, diabetes, or other health problems. And the second point is, you don't have to be blood related to someone to donate a kidney to them. In fact, spouses can all be living donors. It's true that family members have a higher chances of being a good match, but living donor transplants are more successful compared to kidneys from the deceased, that is cadaveric donor, because these kidneys come from the living donors. The third point is, you don't need both of your kidney to stay healthy. It might surprise you to learn that your body doesn't need 2 kidneys to perform an important job, removing the waste and regulating your metabolism. After donating, your remaining kidney will take on the work of the both kidneys. So it is safer to donate and safer to stay healthy even with 1 kidney. The fourth point, your blood and tissue type must be compatible with your recipients. Besides being healthy, living donors must have a compatible blood and tissue types with the kidney recipients. The transplant team will perform the test to see if your blood and tissues are compatible or a healthy match with the kidney recipient. If you are not having the compatible in blood and tissue type, you can go for the incompatible, but it is risky and costly that you need discussion with your transplant team. And the fifth point, you will have test, screening and evaluation to make sure you are a good match. The transplant team will perform the psychosocial and medical test to help ensure you will stay healthy after your donation. Some tests you will have include blood test, urine test, imaging examination, and cancer screening. And also, you need fitness from a team of medical professionals like cardiologist, urologist, psychiatrist, dental, pulmonologist, ENT surgeon, and also gynecologist if you are a female. Suppose if you have diabetes, you need a special fitness from a nephrologist before you are planning to donate the kidney. And next point is, your hospital stay will be short and you can get back to the work fairly quickly. Mostly, living kidney donors stay in the hospital for 0 to 1 day only. Depending on what you do for the work, you can return to the work as soon as 2 weeks or as late as 8 weeks after your surgery. You also should not lift anything heavier than 10 pounds for the first 6 weeks after your surgery. Next, you can still have a baby. Donating a kidney won't make it harder for you to get pregnant or deliver a baby. Living kidney donation doesn't cause fertility problem in women or men. Still, women should wait 1 year after donating a kidney before they get pregnant. This gives your body plenty of time to heal. It's better to have a discussion with the transplant team before you planning to have a baby. Next is, as a donor, no need for any medications after 1 week, except antibiotics you will prescribe for 1 week, and the painkillers, if needed, you can take it. The 8th point is the age. Medical legally, your age should be more than 18, and medically, it is better if your age is less than 60. And the final last point, as a donor, you can have a normal sexual life. Next, let us come to the facts related to the recipient. The first fact is, we are not going to remove your native 2 failed kidneys. It's going to be there in your body only. Actually, we are going to fix the kidney, whichever we are taking from the donor, in the patient's lower abdomen, either in the right or left side, superficially, so that the patient can feel by his hand the kidney. He can feel the kidney by his hand. The second point, as I told in the donor, for the same applicable to the patient's recipient. That is, 1 functioning kidney is sufficient for leading a normal life. The next point is, the patient should take the immunosuppression related to the transplant to keep your new kidney functioning well. And also you have to take BP medications, antihypertensive medications. And if needed, you may need to take the medicines for the diabetes also, as per the transplant team advice. The next point is, the most important thing is, once your new kidney start functioning, no need for dialysis after the transplantation. If your new kidney start functioning, you can drink the water, unlike during the dialysis period where you have to restrict the water intake. But after transplant, you can drink water as much as you desires. And also, you can drive a 2-wheeler, 4-wheeler safely. And next point is, you can have a baby. For that, you need a discussion with the transplant team. Generally, to become pregnant, a female should have a functioning graft. At least she has to wait 1 to 2 years. Her creatinine should be within the normal limit, and the rest of the blood pressure should be under control, and she should be psychologically stable also. Then she should need discussion with the transplant team. Then she can become a pregnant. So there is no any problem for a female or a male patients after a transplant to become a father for a male patient for to become as a mother for the female patients. And next point, as I told in the donor, you can have a normal sexual activities. Another next point is related to the recipient, that you should avoid the smoking, and also you should quit alcohol habits. You should not touch this smoking or alcohol. But at the same time, you should maintain a healthy, clean food habits. Next point is that you have no need for the erythropoietin injection, which you used to give it during dialysis period. For the hemoglobin to get up, to correct the low hemoglobin, we used to give erythropoietin, which is very costly. We used to give once weekly or twice weekly, sometimes thrice weekly during dialysis period. This erythropoietin will be stopped after renal transplantation once your new kidney start functioning. Suppose if you not having any living donor, related donor, you can go for the cadaver kidney, that is brain dead patients. You can be is also eligible to donate the kidney. For that, as a patient, you have to register in one hospital per state. For one state, in one hospital, you can register for you under the cadaver list, so that you will be in the queue, in the waiting list. Whenever you are coming to the near first or second, you will be called then by the hospital wherever you are registered. There you can go and you can get to a transplantation done. This cadaver is comparatively inferior compared to the living donation. Suppose if you don't have any living donor, related donor with you, don't hesitate or don't wait to register under the cadaver registration list in your hospital, whichever you like to register or you want to do the transplant. Next point, you can do a transplant, as I told, even if you are not having the donor, blood and tissue compatible. But the procedure is very risky and it is costly. That need discussion with the transplant team. If you are planning to have a donor who is not compatible blood wise, or a blood ABO incompatibility or a tissue incompatibility, if we have, discuss with the nephrologist and take the decision. And there are certain contraindications are there that for to do the transplant. That also you should know. Everyone cannot do sometimes the transplant. There are few contraindications there that you need a discussion with your transplant team. Final point is, suppose if you have any cancer, then you have to wait for 3 to 5 years as per the transplant team. You have to treat that cancer and then you need discussion with your transplant team. So when you will be fit to go for the renal transplantations. Finally, I have completed my facts related to the donor and the recipient. I hope it's very useful for you. Thank you very much to give me a chance to speak about the facts related to the renal transplant, especially cadavers, healthy donor and recipients. So that I think this will be going to be useful to the CKD patients and their relatives, whosoever planning for the renal transplantations. And it will also going to be useful for the some general population people, and it will remove certain myths about the renal transplantation. Thank you very much.